Well, hello everyone again. This is Dr. Jerry Cuomo. We're in, I guess, the month of January 2011. It's been a while since I've done a recording. I wanted to expose you to a case today. We're working on John. His tooth number is I believe that's 14, and he had a failed root canal crown at root split. So now we're looking at the pre-op X-ray of this particular tooth, and we'll move on. And here's actually a Straumann wide neck posterior implant that was placed in this area. The dental surgeon, periodontist, in this particular case, angled it a little bit to the mesial aspect to avoid going into the maxillary sinus. And so we have a custom abutment that we'll be making to facilitate this case. And so we have a couple of concerns. Number one, we must make sure that the contact areas are parallel with each other, not necessarily parallel with the implant head. The laboratory will make the custom abutment that will then parallel its walls up to that of the adjacent teeth. Okay, so without any further ado, we're going to go ahead and show you the individual items. This is our Synocta impression cylinder, because we're going to a level of tissue level impression. We'll go ahead and get that open. And this is the way they come right out of the box. Now the other concern here now is this wide neck impression cap. Same color code. Now at times we would have to custom make the outside of this because it might be a little too close to a contact area. We'll find out if that mesial of that bicuspid or the distal of the bicuspid adjacent to this impression is going to be a factor. Alright, those are the two components. We're going to go ahead and take a look at John now. The dental surgeon, the periodontist, has already told us that it's 2 millimeters in depth of tissue height. Okay, let's go have a dry angle, please. John, I'm going to use a little dry angle that's going to go up and protect your cheek. And we have John today. He actually has his video eyewear on. We'll just show you those. That's a video eyewear. And he's watching as we're treating today. John, can you see all right in there? No problem. Okay. Gray mirror. Okay. Okay, so here we are. This is the top of the healing abutment. Nicely done. We see a beautiful gingival complex, but even before we remove the healing abutment, Explorer, please. We're going to check the path of insertion. Okay, so with the microscope, we can actually do that at high power. Move it right on up to about 5 power here. And we can close one eye in the microscope and actually check the parallelism. Looks like we're perfect, so we really don't even need to touch really anything. We've got a nice highly polished contact area on both. These are both cold castings, so that saves another step. We're also going to check to see if he's got any other spaces in between his upper teeth, which you might want to block out with wax. Alright. Okay, so let's go ahead. And we'll remove the healing abutment. Retract only. And this is a star wrench. I'm just going to insert that. Let's see if we can hand tighten that. Go a little bit more. Retract higher, please. Here. Okay, so there we are. That's the angle of the implant. So you know it's going a little bit toward the distal. And that's why we're going to custom make this today. Alright, so now if we untwist that gently, out it should come. Straumann makes a star wrench that grabs also. It has a nice little tendency to hold on to healing abutments, so we can pull that out and not drop it. Okay. And there's the head of the implant itself. Tissue height is actually not 2 millimeters. It's almost right to the hub of the implant. So we're going to use something called a micro suction tip. And John, can you see that pretty well? Yeah. So that's the inside. And I'm going to show you the internal anatomy. Now he coats this with a lot of antibiotic material. It's a clear gel. Some of the surgeons will use an oxygel to prevent oxidation above. Looks like he got this one right on the button. Looks great as far as vertical height. So we're going to just suction away and turn that on. Let's see. Looks like our suction's on. Okay. And we'll keep going with that. And go inside. Yeah, you really lubed it up well. Alright. We need a little bit of that blue astringent material. And we're just suctioning up a little bit of this excess of tissue right back here. Sometimes, John, a few of the little particles might come up from around the implant. And that's the artificial bone that was placed around that site. So if you had to graft it a little bit, you might see that. So I'm just suctioning right now. All set with that? Okay. Yeah, I'm going to use a product. What's the name of that product, Jen? Hemistil? Hemistil. What company is it from? Kerr. Okay. And we're going to use a little bit of this Kerr company material. And we'll squeeze some of that out. Okay. Got it. And we just want to quiet this area a little bit. So this is a special conditioner. All right. And we're going to let that set for about a minute or so, Jen? Okay. Right around 30 seconds. Okay. Okay. And what that'll do is it'll quiet the capillaries down, cleans it up nicely, and then we'll get ready for a final impression. So we'll rinse all that off for you. Is that okay, John? Everything good? Yeah, no problem. All right. All right, we're going to go ahead and rinse that off. And a little on the bicuspid there. Great. All right, looks good. All right, great. On the microsuction now, we'll go back in, do the same thing with the microsuction. After the microsuction, we're going to go ahead and place our impression coping and associated cap with that. All right. We're pretty much debris free at this point. Give that to you. Okay, so here we go. This is it's a little snap-on device, snap-on rim. So we're going to set it in position and make sure it's aligned properly. Now see right away it's pretty close to that mesial aspect of 15. We just want to make sure it doesn't come into contact. So I'm going to push on that straight until we hear a snap. There's a snap. Alright, so looks like we're almost dead on. Looks good. So now we're going to vacuum again with the small vacuum. This is I believe this is a 20 gauge suction tip for those who want to pick it up. I believe the company is called Vista. And Ultradent's another good company. It's a Lock, so you can plug it into, yeah, this connector actually is the oh, sorry, John. This is the connector for the Lock. Alright, and that gets in place. And I think my time's coming up to about 10 minutes now, so I'm going to have to sign off, and we'll do one more segment of the impression. This is Dr. Jerry Cuomo with John doing a impression for a wide neck Straumann impression. Looks like we're going to have a nice outcome. I'll catch you on the next video.